Hello and welcome to another video on endocrine physiology. Today we're going to talk about cortisol. As you probably know, cortisol is produced and secreted by the adrenal glands, which consist of two parts, the adrenal cortex and the adrenal medulla. The adrenal medulla secretes catecholamines, epinephrine and norepinephrine, and the adrenal cortex secretes cortisol together with other hormones. The cortex itself consists of three parts, zona glomerulosa, zona fasciculata, and zona reticularis, and each secretes a different hormone. For us, the zona fasciculata is important because it secretes cortisol. Cortisol is classified as a glucocorticoid. Glucocorticoids are hormones that increase glucose concentration in blood, which, as you will see in a few seconds, is exactly what cortisol does. Okay, now we know how to classify cortisol, and we also know where it's secreted, so let's look at the most important thing, and that's what cortisol does. Cortisol's first effect, which we've already kind of talked about, is that it stimulates gluconeogenesis. In other words, the synthesis of glucose. How? Cortisol stimulates the liver to create more glucose, and it also decreases the synthesis of new proteins, and at the same time it increases protein catabolism, the breakdown of proteins. And it does all of these things to provide more amino acids to the liver for gluconeogenesis. Cortisol also mobilizes fatty acids from adipose tissue so that they are then available in plasma as a source of energy for cells instead of glucose during starvation or stress. It also decreases the glucose utilization by tissues, so in other words, tissues don't use that much glucose as a source of energy. All of this leads to increased levels of glucose, which stimulates the secretion of insulin, and we get something called the diabetogenic effect. Why it's called diabetogenic effect? Well, you know that if someone has diabetes, then they have kind of a similar situation to what we've just described. They have a high concentration of glucose, which requires more insulin, which they don't have, or the tissue is resistant to it. Of course, here we're not talking about an actual diabetes, but the high glucose concentration and the need for more insulin are very similar, so diabetogenic effect. By the way, growth hormone, somatotropin, also has a diabetogenic effect. So everything we just said about the gluconeogenesis is very important because it means that the body is able to mobilize glucose between meals or even during fasting, and that's essential for survival. Okay, so moving on. Cortisol has an anti-inflammatory effect and it can suppress the immune system. How does that happen? Cortisol decreases the formation of prostaglandins and leukotrienes, which, as you perhaps know from biochemistry, are inflammatory mediators. Because of that, we're going to have a decreased white blood cells mobility, so that means that not that many leukocytes are going to get to the inflamed area, and there's then not going to be that much phagocytosis of the damaged cells. This is going to reduce the inflammation, and that's why cortisol is often used in medicine to reduce inflammations. Cortisol also decreases the production of lymphocytes, especially T lymphocytes, which suppresses the immune system, and this effect is also used in medicine because you can give cortisol to patients with transplanted organs so that their bodies don't reject them. So again, quite important. Cortisol also plays a role in regulating blood pressure because it upregulates alpha-1 adrenergic receptors in arterioles. Upregulation simply means that there's more of these receptors. And why are these receptors important? They're important for catecholamines, so epinephrine and norepinephrine, that cause vasoconstriction. What's more, cortisol inhibits bone formation by inhibiting the formation of osteoblasts. And this is once again important because if you suffer from hypercortisolism, meaning that there was too much cortisol in your body, then you could suffer from osteoporosis. Cortisol has many other effects, for example on the nervous system, but I think these were the most important ones and that we can now look at the way it's secreted. Cortisol follows a diurnal pattern, meaning a pattern which repeats daily. Throughout the day, cortisol's levels increase significantly. They increase the most just before waking up, and they are at their lowest during the evening and after falling asleep. Apart from this diurnal pattern, cortisol is secreted in response to stress and is nicknamed the stress hormone. If you think about it, we said that cortisol has a big role in providing the body with glucose, which can be used in a stressful situation as a source of energy, so this makes sense. Moving on to its regulation, cortisol is regulated by the adrenal corticotropic hormone, which is secreted by the anterior pituitary. However, in order for the adrenocorticotropic hormone to be synthesized, a lot of things have to happen. So let's take a look. First, the so-called corticotropin-releasing hormone has to be secreted by the cells of the paraventricular nuclei in the hypothalamus, which gives a signal from the central nervous system that cortisol is needed. Corticotropin-releasing hormone then gets by the primary capillary plexus to the anterior pituitary, and here it stimulates the secretion of adrenocorticotropic hormone, which in turn stimulates the secretion of cortisol. Of course, adrenocorticotropic hormone and corticotropin-releasing hormone follow cortisol's diurnal pattern, so that cortisol is, as we said, secreted the most in the early morning and the least in the evening. Negative feedback also plays a role in the regulation of cortisol because cortisol inhibits the secretion of the corticotropin-releasing hormone from the hypothalamus, and it also decreases adrenocorticotropic hormone formation in the anterior pituitary. Remember that the purpose of negative feedback is to ensure that we don't have too much of the hormone. So if there's a lot of cortisol, cortisol itself is going to inhibit secretion of corticotropin-releasing hormone and adrenocorticotropic hormone, and that means that there's not going to be too much cortisol, okay? Great, so this is it for cortisol. By the way, if you'd like to practice what we've learned today and check that you've understood everything, then head to our Instagram where we put practice questions that you can use. I hope you found this video helpful and at least a little bit interesting. For more videos, please subscribe. Thank you for watching, and until next time, don't forget that medicine can be easy.